Hello, my name is Alexandra Orozco and I have paired up with Angelica Brown. She will be introducing herself in the next couple of slides, and our project is on breastfeeding, position, and latching techniques. So let's get started. What are common latch problems? Common latch problems include poor positioning, meaning that the mom is either hunched over a baby and pushing breast into baby's mouth, making it difficult for baby to latch on. Flat or inverted nipples can make it more difficult for the baby to latch, but it is not impossible. Baby's body is out of line, meaning that the baby's head and body are not in line with the breast, and an empty breast, which will make it difficult for baby to latch because little to nothing is coming out. So, techniques for flat or inverted nipples. Rolling out nipples before feeding can help draw nipple out before feeding. Compress breast to a V or C shape using a breast pump, which will help boost milk supply, and using a nipple shield, which will hold the nipple in an extended position, which is ideal for breastfeeding. Infant body techniques are modified cradle position, side lying position, laid back after C-section, scissor hand hold position, C hold hand position, and koala hold. So our first position that I will be going over is modified cradle position. As you can see in this picture, so here are the directions. If feeding with the left breast, the mother supports the baby's head with her right hand at nape of the baby's neck. The mother places her right thumb by the baby's left ear and right forefinger near the baby's right ear. With the mother's free left hand, she can offer her left breast. So let's pause for a bit and do a few Q&A questions. What should a mom do if her newborn falls asleep after the first few suckles? If baby falls asleep, mom should remove blankets and clothes and cover baby with a light blanket, or have baby in a burping position while walking fingers along the back. Our next position is side lying position, and as you can see in the picture, that is side lying, and we are going to have the mother rest comfortably lying on her side using pillows to support mother's head and back. Place the baby in side lying position next to the mother's body, and with the mother's free right hand, she can offer her left breast, and this position is also very helpful for moms that are recovering from a C-section. Next, cradle position. So you want to place the baby on the mother's lap and turn the baby's entire body towards the mother, as if the baby is in a side lying position. If feeding from the left breast, have mother cradle the baby's head near the crook of her left arm while supporting her baby's body with her left arm.
Hi everybody, this is Angelica, Alex's partner. Before we move on to the rest of the slides, let's go ahead and do a Q&A. Why would a mother be in a supine position to breastfeed after having a C-section? I'll give you guys a few seconds and we'll go to the answer. That is correct. It is because of the wound. So when a mother gets a C-section, their pubic hairline is through the uterus is cut horizontally. So having pressure or weight is very painful and uncomfortable. So seeing this picture, this baby is a little older. So for a newborn, a side laying position that Alex discussed earlier in the slide is another option. The next one we have here is the C-hold hand position. So you can have the baby in whatever position you are comfortable with. However, it's more of the form of the fingers. So it's the thumb being on the top and the rest of the fingers at the bottom of the breast. And this is beneficial for mothers who have large breasts because they can help kind of carry the weight with their hand. And they can also kind of help direct that nipple into the newborn's mouth so they can latch. Another one is the scissor hand position. So it's not, like I said, you can have the baby in a position that the mother is comfortable with. It's more the form of the fingers. So the index in the middle is holding the base of the areola. So this is good for mothers with small breasts, flat or inverted nipples, because then they can form the nipple so it can help them or help the baby latch. And it's recommended that you don't press deeply because you can obstruct the milk flow. The koala hold is having the baby's spine and head upright. Obviously with newborns, because they don't have that capability yet, they need a lot of support. So for older babies, such as the picture, they can straddle to your thigh or the hip. And this is typically good for babies that have chronic reflux or ear infections. This one right here is called football rugby, or double football rugby for twins. So if you have a baby or babies, they're basically tucked under your arms. Your hand is supporting their head. And I've seen some that are able to just support the baby alone with their hand. And for others, you can definitely put a pillow for support. Signs that breastfeeding is effective. The first one is that babies usually have a rhythmic suckling pattern with a brief pause. The next one is that mothers can usually see or hear the swallowing. And breast is usually soft after feeding. If you usually hear or see women, they're talking about their breast being engorged or being in pain, that's because they need to pump or feed, since there's a lot of milk that needs to be released. Lastly, the newborns usually pull away or fall asleep. However, keep in mind that when babies fall asleep and awakens very quickly, this is a possible sign that the feeding previously was ineffective. So it's recommended that you offer the breast again. So our last Q&A for this presentation. How many times a day does a newborn generally feed? I'll give you guys a few seconds. Right, at least 8 times per day, because newborns typically feed every 2 to 3 hours. These are newborns that are breastfed. They usually eat every 2 to 3 hours. So the least amount is 8 times per day. And the most is usually, if it's every 2 hours, it's 12 times per day. So it's between 8 to 12 times per day. And that is the end of their presentation. I want to thank you all for watching and hope you all have a good day.